Hello students, today we are going to discuss about the tricuspid atresia, and this topic belongs to child health nursing for BSc nursing third year. What is tricuspid atresia? Tricuspid, it is a valve. It is also known as atrioventricular valve, and it is present between the right atrium and right ventricle, and it become a work as a communicator between the right atrium and right ventricle, and the right atrium pour blood into the right ventricle with the help of tricuspid valve. But in case of tricuspid atresia, when the valve is not present due to any development during the time of embryology. Okay, next is the definition. In this, the tricuspid valve fails to develop and no communication exists between the right atrium and right ventricle. Okay. Then the incidence approximately 2 to 3% of all congenital heart defects in all the congenital diseases and pathophysiology. What happened here? Tricuspid valve failed to develop at the time of embryological development, and there is no communication between right atrium and right ventricle, and right ventricle become small, also known as hypoplastic. How? Because there is no communication of the blood. If the right ventricle small, then right ventricle have no blood, and it is not given to the pulmonary artery. Okay, then if the right ventricle hypoplastic, then AST and patent foramen ovale also present in this condition, tricuspid atresia, and VST also common in tricuspid atresia. Then pulmonary artery may be small and normal in size, might be normal, might be small than normal. Then unoxygenated blood returning to the right atrium because there is no way to pass through to right ventricle. Okay, then the next is the passes through arterial septal defect. That's why the blood present in the right atrium with the help through AST and foramen ovale, it goes into left atrium and left ventricle. What is foramen ovale? Foramen ovale is present on the wall between the both upper chamber, means right atrium and left atrium. Then some blood flow through VST towards the right ventricle, and it goes to the pulmonary circulation. If VST is not present, then blood flow to lungs is only through patent ductus arteriosus. I hope you understand about the pathophysiology. Next is clinical feature. Profound cyanosis. Why? Because most of the blood received by the left side, it is deoxygenated. Hypoxic spell. What happened in hypoxic spell? When the person or child suffering from hypoxic spell, he's suffering from central cyanosis. What do you mean by central cyanosis? When the infant suffering from blue lips color converted into blue, and the mucous membrane also blue, nails bed looks like blue discoloration, that time it is known as hypoxic spells. Or tachypnea, delayed growth, acidosis, clubbing of nails, there is a normal shape of nail, and congestive heart failure. What happened in congestive heart failure? It affects the pumping power of heart muscle. In disease, it affects the pumping power of heart muscle. Then the diagnostic evaluation. What happened in cardiac examination? In cardiac examination, the physician or surgeon or cardiologist assess the murmur sound, which is present if it is present due to the ventricular septal defect or PTA. Then electrocardiogram. In electrocardiogram show the right and left atrial enlargement. And chest radiography shows the normal size of the heart, or might be the size is increased. And echocardiogram shows that the tricuspid valve is not present, the right ventricle size is small, and VST also present, AST present, PDA present. These all kinds of things we know from the echocardiogram. The next is therapeutic management. In therapeutic management, first of all, medical management. If the infant suffering from tricuspid atresia and depend totally on pulmonary PDA, patent ductus arteriosus, for pulmonary blood flow or pulmonary circulation, then prostaglandin given to them in continuation with the help of infusion, and the till the surgery is not performed, because prostaglandin help to maintain the patency of ductus arteriosus, right? Then the surgical management, palliative surgery. What happened in palliative surgery? Palliative surgery divided into two: Blalock tossing shunt and balloon arterial septostomy. Blalock tossing shunt is the shunt in here right or left subclavian artery connected with the pulmonary artery, so that the blood circulation should be improved in the pulmonary circulation. And balloon arterial septostomy, it performed when the Blalock tossing shunt is failed, and balloon arterial septostomy done to ensure the interarterial communication, interarterial communication, because the right atrium do not have another outlet for the blood without the interarterial communication. Okay, next is corrective surgery. In corrective surgery, all the conditions which are present in atrial in tricuspid atresia, it is improved with the help of surgery. And in corrective surgery, the circulation comes back on the normal blood flow or normal circulation of the heart. Then post-operative complications, congestive heart failure might be occurring in this condition, renal failure, residual VST means a small VST also present after the treatment, infective endocarditis, dysrhythmias, and conduit obstruction also present. I hope you clear with this lecture. If you feel any kind of problem, then kindly inform me. I feel very happy to help you. Thank you very much. Take care. Stay at home. Stay safe.